I think there are still very significant unmet needs for myeloma patients. Obviously, the treatment paradigm is improving all of the time. There are several things that still concern me. I think, first of all, patients are still being diagnosed too late when the myeloma has done significant damage. So delayed diagnosis, number one unmet need. I think we need to take thalidomide out of the treatment pathway because it is associated with high rates of neuropathy, and we should be using Daro-VRD rather than Daro-VTD because we know that combination of Velcade and thalidomide are very neurotoxic. I think, so those are two unmet needs. I think the third big unmet need is patients with ultra high risk cytogenetics, more than 2 abnormalities or 2 or more abnormalities. And even with improvements in conventional therapy, those patients still don't do very well. So my 3 big unmet needs are: we need to make diagnosis more rapidly, we need to get rid of thalidomide from Daro-VTD and replace it with Revlimid, and we need to have a stylized treatment regime for patients with high risk cytogenetics.